I'm Richelle Carulasan and I'm going to discuss about Chapter 12, which is Drugs Microbes Host the Elements of Chemotherapy. So first, what is the goal of antimicrobial treatment? The goal of this is to destroy the infectious agents and do no harm to the host. There are sources of most commonly used antimicrobial drugs. They are bacteria and fungi. There are two methods in testing the antimicrobial susceptibility: the Kirby-Bauer test and minimum inhibitory concentration. The Kirby-Bauer test identifies the antimicrobials that are effective against a specific infectious bacterial isolate, while minimum inhibitory concentration identify the smallest effective dose of an antimicrobial toxic to the infecting microbe. Next is therapeutic index. It is a ratio of the amount of drug toxic to the infected host and the minimum inhibitory concentration. The smaller the ratio, the greater the potential for toxic host-drug reactions. Next is selective toxicity. An antibiotic should be selectively toxic, meaning that it harms the microbe but not the host. There are 5 major targets of antimicrobial agents. They are inhibition of cell wall synthesis, inhibition of nucleic acid structure and function, inhibition of protein synthesis, inhibition of folic acid synthesis, and interference with cell membrane structure and function. So, what categories of drugs are most selectively toxic and why they exhibit this effect? The answer is cell wall inhibitors. They exhibit this effect because we don't have cell wall in our body. So there are classification of antibiotics. Based on mode of action, there are bacteriostatic and bactericidal. Based on their spectrum of action, they are broad spectrum and narrow spectrum. Narrow spectrum antibiotics acts against a limited group of bacteria, while broad spectrum antibiotics act against a larger group of bacteria. This is the development of penicillin. Penicillin was first discovered by Alexander Fleming. The discovery of this is very important because it gave doctors an effective way to treat bacterial illnesses. Next is beta-lactamase. It is an enzyme produced by bacteria that break the lactam ring of penicillins and clomosporins, rendering the drug inactive. There are examples of beta-lactam. Thank you.